So next up, we have my co-worker, Nagham, who is going to be talking about our program for addressing domestic and sexual violence. So I'm just going to hand it over straight to you, Nagham.
Thank you, Madiha. Thanks for inviting me, Alex. I appreciate you taking the time to meet with me and speak to me in regards to the symposium. I'm honored to be a guest speaker. I don't have any slides to share today, but what I do have is to share the work that we do at Access and specifically the program that I oversee. So my name is Nagham Dabaja. I am a professional counselor at Access. I have been with the organization for 8 years. In about 10 days, it'll be 8 years. I am blessed to be a part of such an organization that has been providing services to individuals for the past 50 years. So what I do is I'm currently the supervisor for our Survivors of Violence Empowerment programs at Access. And so what we do is we focus mainly on empowering individuals that have been victimized within the Tri-County area. And we are funded on both a federal and state level. We have been around for almost 13 years now. And currently, this year alone, we have serviced over 900 individuals and their families. The services that we provide are wraparound services, and it's a clinical approach. So we have a team of therapists, we have caseworkers, we have legal aid, we have employment specialists, victim advocates, psychiatry services. Basically anything that the client may need, they can come in and we would be providing those resources for them to meet their basic needs and get them back on their feet and finding sustainability. As of right now, we have a team of about 22 individuals, both in the Dearborn location and in Sterling Heights. And what we do is we have housing that we provide transitional housing also to survivors of domestic violence, sexual assault, dating violence, and stalking. We got this transitional housing grant in 2017. It is funded by both federal and state. So we started off with 4 units at the time. It was like a trial run, and we currently have about 16 units right now. All of them are fully vacant. They have been staying within the program for 24 months. After 24 months, they, get transitioned out successfully. Some draw lottery draw of Section 8 vouchers. So some of them get lucky in that sense where they are able to maintain Section 8 long-term. So this is something that is, very near and dear to my heart. Is transitional housing is something that I took on before becoming the supervisor of the entire program for SVE. We currently do a domestic violence awareness fundraiser dinner every year. We just wrapped up this year. And this is something that we were hosting for the past 11 years. We used to do it in person, but unfortunately, due to the pandemic, we had to move to a virtual approach 2 years ago. And we saw that moving virtually was actually more successful because social media outlets go viral. And we were able to raise triple the funds that we do for in-person fundraising events. So we were very fortunate in that sense. And these funds go strictly towards emergency services for clients because the funding that we receive from our grants are not for emergency services. They're very limited in providing financial assistance to survivors. So with these funds, we're able to provide temporary relocation. We are able to provide rent, first month's rent, deposit, utilities, car repairs, car payments if it's within the budget, food, furniture, clothing, utilities. A lot of our clients get shut-off notices for their electricity. So we're able to assist our clients in that sense. And that is something that we will continue to do, because without that support, we won't be able to provide the full extent of what we can do for these families. I have my staff that are constantly coming to me saying these families need clothing for the winter. They need clothes, they need shoes, they need boots, they need coats. And I'm so fortunate to be able to say it's approved. You can move forward, you can proceed with the payments, you can buy them what they need without having to enable their behavior. So the team works with them to empower them. And, you know, we start with where they're at. We meet clients with where they're at, and we just move forward with that, with their, we let them lead the way. So when they come to us for assistance. And sometimes, you know, we offer therapy services, and sometimes you just need to meet the client where they're at. If their basic needs are not being met at the time, you have to put away the sense of, okay, they need therapy, they need psychiatry, they need advocacy. If their basic needs are not being met, then they're not going to be able to proceed in bettering their life. I know I have about 2 minutes left. Thank you, Madiha, for the reminder. But as of right now, you know, I am very fortunate in the sense that, you know, my team are my colleagues. We are mental health professionals, we are legal. We don't do any research, unfortunately, but we do help the underserved communities. And our survivors are not only of Arab descent, but majority are. And unfortunately, they do have several barriers that are standing in the way of finding sustainability. And when I say barriers, that means transportation, financial barriers, educational barriers, language barriers. So I welcome you all to come and meet with me in person. I want you guys to see it, the work that we do, and you'd be amazed at, you know, the services that we provide within the Tri-County area. I appreciate you all.
Thank you so much, Nagham. And I will say there was one research project that we had done on reproductive coercion, which I thought was really interesting to see that reproductive coercion is a form of domestic violence. And oftentimes, you know, the patients Nagham sees continue to come back and remain in an abusive relationship because they got pregnant. So just something for us to think about. And thank you. I appreciate so much. I know you have a newborn baby, so thank you for your time tonight.
Thank you, everybody.